climate change. She is their program manager. Thanks for joining us
Yeah,
today.
thanks for having me.
Well, I appreciate your coming in to talk with folks just a little bit, giving an overview about the position in itself, what you're looking at in terms of specifically health impacts as it pertains to climate change.
Yeah, well, so we know that climate change is already happening. We can see its effects, including on health here in Rhode Island. Some important facts are that it's getting warmer already, a couple degrees that we're already experiencing here in Rhode Island. That's especially in the summertime with longer extreme heat periods. It doesn't get as cool at night, which is harder on people that are more vulnerable physically. We're also seeing a lot more rain, so you probably noticed these big bursts of rain or big snows. And so we actually saw something like a 76% increase in intense rainstorms here in Rhode Island from the past. And so that's important because you get more flooding. It's harder for, say, farmers to work their fields. And we're also seeing then drought. So it's these big bursts of rain and then big drought, and that has health effects as well. And then one other one to point out are ticks and mosquitoes.
Yes,
so
that's on my list.
So that's a concern for, especially in southern Rhode Island. When we don't have the cold winters, it's more likely for these ticks and mosquitoes and other vector-borne diseases that are carried by them to expand, be more prevalent in our state.
So how do we, how does the state begin to address that? I mean, how does the proliferation of, ticks and mosquitoes, and let's start with that, what can we do?
Yeah, well, so you can do this. The Department of Health has already taken action. We have a big promotion. You'll actually see it at the POSOX this summer. We're doing ads and other kinds of events with the POSOX to try and get the word out that you can do things to protect yourself. So you need to spray with DEET. You can put spray in your clothing. You can take care of your yard. Make sure that there isn't standing water. And then after you're outside, you check yourself, you check your kids in the shower, and then you remove the ticks following the right kind of protocol. So that's one step.
That's one step. And what is proper tick removal protocol? Do you need that special tool?
There is. There's like this little spoon. We're actually handing it out through school nurses.
Are you?
With these coloring books because we also realize that when kids learn something and they bring it home and they say, "Hey, mom and dad, like we have to do this," and that's more effective than talking to the parents. So you can use a spoon. You can use tweezers. It's good, Google it and just find out what to do, and then follow that on YouTube or something like that.
So what's the importance is what getting getting the entire entity out?
Yeah.
Is that sort of like?
Yep. Take the whole thing. Yeah.
And so what, especially from the health perspective, if you don't know that you've done, what are the symptoms if you've gotten a tick-borne disease? For instance, that you didn't know and you didn't see it on your body. What should folks watch for? Yeah, so you can look for, so Lyme disease is one of the main reasons to be concerned. And you'll see often like a bullseye, and there are other kinds of physical symptoms. I'm not a doctor, and so I'm not going to give like the super clinical advice, but it's the sort of thing that you want to find some information online and check for it. It's also something to make sure that doctors know about. So we're doing some work with medical professionals to let them know about how some of the conditions are changing here in Rhode Island. And so maybe a doctor who isn't used to looking for Lyme disease should be looking for it, or maybe a doctor who works with seniors should be talking to them about what to do about extreme heat and how to take care of themselves in the summertime, that kind of thing. And any concerns about rising sea level?
Yeah. So we're a coastal state. There's that T-shirt. Rhode Island is 3% bigger at low tide, right?
And so there's a T-shirt.
Yeah, there's a T-shirt, and so we're going to be smaller, especially at a high tide. And so we're already seeing that. We've seen it increase already, and that's coming, especially for our coastal states. But in addition to sea level rise, we also need to think about things like nuisance flooding. So there was a big it wasn't even a big rainstorm, but there was a rainstorm here in Providence, and I was noticing as I went through that there were just these big puddles. We're seeing it in Dew Point Park, especially at high tide, and so there's more and more flooding. And then the other thing that I think a lot of people don't really recognize is that with storms, it's especially about the wind. So we were seeing that with all the trees coming down, and that's a real and the power outage. So that's a real. So with something like windstorm, it's dangerous. People can be hit by a tree, but then also if your power goes out and your medication needs to be refrigerated, so you need to think ahead about that sort of thing. Know where your shelters are in your town, so that you could go if you need to. If you lose heat or you lose air conditioning, you have your sort of personal preparedness kit ready, where your medications are, that sort of thing.
So do we think, as you said, with warmer temps, have we seen the cities and towns respond in turn with cooling centers and things of that nature in terms of how we approach dealing with the most vulnerable in the most extreme conditions?
Yeah, so there are, towns are definitely responding. There are cooling centers. A lot of times it's at libraries, and it's good to know where they are. We also did a project, just speaking of vulnerable populations, so my program did this great project working with senior assisted living facilities, other kinds of nursing homes, that sort of thing, to help them prepare for events, knowing that seniors are especially vulnerable, and so helping the living facilities prepare for a storm, helping them shelter in place, think about generators, that sort of thing.
And I know that you have looked at, and the department has looked at, health disparities, right, in different economic areas throughout the state in terms of perhaps some more affluent areas have access to AC and to generators as opposed to others that don't. How much does that play into it, and does the state really take a role in looking at it and saying, how can we equally help all of our population? Yeah,
that's exactly right. So we think of climate change like a risk amplifier, so the people that are already at more risk that will be exacerbated by climate change. And so it's important when we're looking at our policies that we take into account that health equity lens of being concerned about vulnerable populations. And that's something like, so there's sea level rise, but there's also, if you're thinking about urban areas, extreme heat, and exactly what you're saying of thinking about that there are some homes that don't have air conditioning. What can we do about that? The state is now developing a statewide climate resiliency action strategy, and the Department of Health is part of that with lots of other agencies. And one of the lenses that we're looking at is thinking about what are we doing for these most vulnerable populations.
And so as you're working with different stakeholders on this strategy, when will us as the general public see the results of this? Do we have a time frame, or is it ongoing?
The strategy is coming out this summer.
Okay.
So we'll be hearing about that. But then the implementation is now, and we just keep going.
So talk with us. What will we see here as a public? I don't want to, to have the secret sauce out there, but what will be some of the points that we will see unveiled in the strategy?
Yeah. So the purpose of it is to identify the investments that the state can make now to better prepare us for climate change. And so it's a mix of infrastructure investments, looking at what do we need to do about our dams or our bridges, transportation, down to at the community level, what can we do to support housing so that it is more climate resilient. So it's across a range, and it's especially focused on what the state can do.
So we're going to see the Department of Health at POSOX Games with the tick removal education campaign. We're looking for the strategy report to come out this summer. What else will we see from the program?
So we're working on a few different projects on these topics that you just mentioned. We're working on some different analyses around extreme heat and considering some different policies that we could put forward to help. We have this great brochure and a video that they could find on our website. If you're maybe looking to find out a little bit more about the health effects of climate change and maybe share it, you could download it and share it and help spread the word. We're continuing working with our senior living facilities. And then if, I think we're open. The point is that we're serving the public and bringing forth their priorities. So looking for other guidance.
Well, I anticipate we likely will have you back in studio when this strategy report is released, but again, likely to see the Department of Health and the climate change program again at the POSOX Games this summer. Will you be other places as well? Is that like your focal point?
Yeah, where else are we going to be? So we certainly have a social media presence. We like to do tabling at community events, someplace where we can actually have a conversation with people. I think, that probably covers it.
So we've seen, we do know temperatures are getting higher.
Yes.
And have we seen research about, is it on par with what we thought, or is it getting higher quicker than anticipated?
Well, I'm not sure about heat. I wouldn't be surprised, but certainly the projections about sea level rise and precipitation, that kind of thing, it's tracking on the kind of the worst projections. So when climate modelers are doing their work, they're thinking about, well, what's the range of what could happen in the future based on these different emission scenarios, like how much carbon dioxide we're putting out into the atmosphere, but then also how our global ecological system reacts to it. And so like researchers in the Arctic have been finding that actually the ice has been melting faster than they anticipated, that sort of thing. It's really, the Earth is pretty complicated. It's hard for us to know everything. And so what we found is that it's on the high track. And so we need to do more to lower it as much as we can. And so our program is focused especially on how to adapt to climate change, but the Rhode Island government is certainly also focused on how we reduce our emissions and do our part, and that's really important
A
too.
multi-pronged approach, but I appreciate you taking the time to come in here and give folks a little bit of an insight as to actually what takes place here in the climate change program. And you're the manager, so you're the expert on the issue, but if you see them out at events, go up, say hello, ask your questions. If you see them at the Paw Sox game as well, I appreciate you taking the time
Thanks
to
so
come
much,
out.
I really appreciate
Laura Bozzi,
it.
thanks so much.
Thanks
I'll let
so
you go
much.
around the corner.
Okay.
Laura Bozzi with the Rhode Island Department of Health is the Climate Change Program Manager. Appreciate your taking the time to come here and put out information. Thanks for tuning in to the 3 o'clock show. It was a just Republican at Providence College talking about unequal coverage. Her recent book, taking a look at personal stories pertaining to the Affordable Care Act and where it worked in places and where she said from her research it did not. 3:15 we had Dr. Christina Connett. She is the curator at the New Bedford Whaling Museum talking about all the great exhibits they have going on now and to come this summer. And Laura Bozzi with the Department of Health. I appreciate you taking the time to come into the studio. And if you